It's quite a complicated question, but I think that I'll take a couple of segments of that.
Okay.
One is from where I sit, clearly the IPO, the Interagency Program Office, along with the efforts from the White House and the HHS, we are currently coordinating our efforts around the beacon communities or beacon partners, the NWHIN efforts, the VEALER, which is connected to that. So I am beginning to see how the national programs are being connected or coordinated, at a minimum. Now, are they fully coordinated where the states, everything is? Not yet, but I see the beginnings of the structure and the intent that's fairly clear. I think that's just one piece. I think that when you begin to look at, okay, we recognize that the data is exploding, and we need to get a better handle for how we make the huge amounts of data into information to knowledge so that it actually impacts change at the patient level or at the provider level. To begin to do that, the coordination that we've had with ARC and HHS is, can we create a collaboratory in which the clinical decision support can be done collectively on a standardized fashion so that everyone can benefit, whether you're a one or two man practice shop or a large organization like Kaiser or Geisinger's, to be able to say, okay, here's an encoded way you can download that knowledge in a way that can be consumed by their electronic health record very easily, which then can then take massive information and then make it useful for that setting for that patient. I mean, that's kind of the coordination that we're beginning to work on, but obviously these are huge projects. I just want to add on to Doug's comments, and that is, as we look at the interoperability and the NWHIN efforts, I think perhaps people on the outside don't quite realize that that we have, particularly in DoD and also in VA, a significant part of our healthcare being delivered by the private sector.
Yeah,
so we are now in the 60 to 70% of healthcare being delivered by the civilian network, and this is why HHS and the White House is very involved in coordinating the activities, because you can imagine between the VA and DoD and the presence we have in the localities throughout the country and the world, it really gives us a way to begin to shift the market to get to that inflection point. And I think that's really what we're trying to do.
Yeah, that's a very